Hi everyone. Adu. Hello. Hello Chirag. Today we have Dr. Anuja with us. We'll wait for some more people, then she will join in on the live. Anuja, can you send a request to be in the video? Yes, Advik. Thank you. Will you work? Thank you. पहले व्हॉट्सॲप कर, मी तुला लगेच ग्रुपमध्ये ॲड करते. Yes, Chirag, you can message us. Hi,
Hi,
Anuja.
Rucha. Hi.
Hi. How
Hi.
are you?
Hello, everybody. I'm doing good. How are you?
I'm doing good too.
Great.
कसं क्लिनिक सध्या कसं आहे, म्हणजे पेशंट्स वगैरे?
Sadhya patients आहेत, but then I am only restricting the number, giving staggered appointments, no overlap. All the precautions in between two patients, bed clean karna,
Yes, yes.
sanitization all the time. So it's kind of at getting used to the new normal. So even
Yeah,
patients, one goes and the next comes. So they are not waiting in the waiting area at all.
okay. Good. Naveen, new normal is like
New
every.
normal, totally, totally. And this is going to continue for many, many months. So might as well get used to it and accept it, rather than feeling कि एक खूप odd है. But as of now, just once a day clinic चालू है.
Yes.
टायमिंग सध्या कमी आहे,
Okay.
बट अल्टिमेटली थोडंसं वाढवायला लागेल बिकॉज आता मान्सून मध्ये त्याचे सगळे पण गोष्टी चालू होतील ना, असं होईल.
राईट. पण आता केसेस कमी झाल्यात
ग्रेट.
कोरोनाच्या.
सो आय होप, हो लकीली होपफुली अजून कमी होतील. सो आय एम जस्ट होपिंग की तू संवाद बद्दल इथे सांगशील अजून, लाईक एव्हरीबडी एल्स,
हो,
मे बी एव्हरीबडी एल्स नोज,
नक्कीच.
पण मला पण माहिती आवडेल घ्यायला.
Yes, नक्की सांगेन. आम्ही 27 जूनला चालू केलं आहे. सो इट्स बीन अ
ओ
बिट मोर देन
ओके ओके. राईट. सो इट्स स्टिल अ इन बेबी न्यूनेट.
Yes, it's a new unit. But yeah, we are getting quite a good response from people. We are getting a lot of
That's
clients.
nice.
तर
Great.
मग
That's brilliant.
and the best part is पूर्ण youth ची team आहे. So all the youngsters are there in the team and they are working voluntarily. म्हणजे
That's great.
स्वतःहून
That's great.
they are. So we are now 34
Very
members in
nice.
the team.
Oh, wow. Wonderful.
Thank you.
Great.
So we'll wait for a few more people.
Sure.
Yeah.
Hi, Henna. I can see you have joined.
Abha has joined. So let's see what kind of audience we are getting. म्हणजे which language we can speak in. त्याप्रमाणे. I think
Correct,
English
correct.
will
I
be
think
every.
English with a little mix of Hindi, Marathi, a little bit of both, and mainly English would work for most,
Yeah, yeah.
I guess.
Okay, great.
Okay, Dr. Zui also has joined Nad Brahma Sound Healing. Do you know her? She herself
No,
is a
no,
lactation
no.
consultant and a very good friend of mine.
And thanks for joining in. Hello. Okay, so there are people from my team also over here, Vinny, Abha, and Tejaswini. Tejaswini is the co-founder of Samvad, and
Okay.
she's a MBBS student, but she is like very
Mm-hmm.
proactive and very creative with her stuff, and
That's nice.
she, yeah, yeah. So I was like, you have to be in the Samvad team, so she helps me with everything. So can you introduce yourself to everybody?
Okay.
A
So,
small
hello everybody. Yeah, yeah. So, I am Dr. Anuja Pethe. I am a pediatrician and I'm practicing since more than 11 years now. I'm mainly based in Villaparle and I'm attached to Nanavati Hospital. And my main focus is on preventive pediatrics. So, you know, how small changes in the baby's and child's lifestyle, eating, activities can help, keep them healthier. That has been my focus all along. And along with general pediatrics, I also do a little more work in type 1 diabetics. And I'm associated with Juvenile Diabetes Foundation for that. And because of my association with type 1 diabetic kids, I also am more interested in healthy eating, healthy lifestyle, and you know that can be extrapolated to even those who do not have diabetes, because ultimately food for diabetes is healthy food, which everyone can have. So my focus is mainly on these two things, and of course, the start of nutrition for any newborn is breastfeeding. So I
right.
always, give more time in my first consultation for helping the mother, initiating her and guiding her about breastfeeding. And then, of course, I have my other colleagues who are lactation consultants who, are definitely helping me, giving more help to the lactating mothers. So that is how I am, presently working. So along with general pediatrics, it's more on preventive pediatrics.
That is like music to my ears because I have been learning about
Yes, you yourself are in preventive medicine. Like I told you, when you started off that is going to be the field for the future, rather than treating sickness, we want to maintain and avoid sickness and maintain health and avoid
the
sickness.
best part of community medicine I feel is you can reach out to so many people at a time. Like as a
Actually,
clinic, you can treat asymptomatically, but as a
true.
community, you can reach out to more people and you can prevent diseases from happening. So this week is World Breastfeeding Week. So World Alliance on Breastfeeding Action, they started World Breastfeeding Week in 1992. So from since then, there, a lot of events have been happening regarding breastfeeding and creating awareness. So today is the last day, I think, or tomorrow is the last day. Today
Today
is
is the 1st to 7th
today,
August is the first week of August.
first week of August. So today is the last day. So we have our videos every Friday. So we kept our breastfeeding week special today. So can you tell us something about basics of breastfeed? Like what were the trends of breastfeeding that were happening around you? Like
Okay. So around me, it would be just since the last 10 to max 15 years. Right. But according to me, the trends are improving. So whatever in 15 years of my work in pediatrics as a resident and then, working as a consultant and in my clinic, I have noticed a favorable change that more and more mothers are now, wanting to breastfeed and they are able to successfully breastfeed, which is a very welcome change, and I want to keep uh, helping the cause and have more and more people on board. So that has been my observation. But if you want to just, quickly recap, like historically how things were, all along it has happened that breastfeeding was the immediate, natural, instinctive way to feed a baby. But as man, started progressing, the higher class people somehow started looking down on it like a inferior work or something, And then they used to keep vet nurses, like people, women from lower class who were maybe lactating themselves, and they were maintaining lactation just to feed the kids of the higher class people. And then, that trend continued. Then cow's milk was tried, goat's milk was tried, gradually formula, which is made from cow's milk ultimately, came into being, and then people started using bottles and formula, and so basically the high class women refused to breastfeed. And then again, like, life comes like a full circle. Now we are again going back to our roots. So gradually from 60s, 1960s, 70s, this trend started taking uh, power again, that we need to start breastfeeding our babies, and a lot of benefits of breastfeeding started getting uncovered, and people started getting convinced. And now in the 21st century, fortunately, we are fortunate that the trend has picked up in a very, very good way, and more and
Okay.
more women are breastfeeding. And now that taboo or that class barrier is not there anymore. So anyone who is educated and sensible is wanting to breastfeed their child. And of course, those who are not really educated, or those who do not have much resources, for them, by default, breastfeeding is the easiest option. So for them, it was not so much of a problem. And those who were not really willing to do are also now turning towards breastfeeding, which is a brilliant trend according to me. So let us,
Yeah.
just join hands and do more for this.
Yeah, happy to hear that now breastfeeding is coming. Like everybody is starting to breastfeed. But is it exclusive breastfeeding, or what is the modern trend like, or formula feeds, or
So again, the right. So the trend of exclusive breastfeeding has also increased in my whatever experience I have. I have seen babies. So when my practice was new, the trend was more towards mixed feeding, and then a lot of mothers were really little easily giving up and not really feeding because of some minor discomfort. And but then gradually I started counseling themselves myself in the clinic, and then I realized I also have certain restrictions because I can't devote a lot of time in the clinic. Then I had my lactation consultant friends also, whom then I used to refer. So they used to do home visits to the mothers' houses, or they used to call the mother exclusively for that. So rather than having a crying baby outside in the OPD, and then not being able to give a lot of time to the mother, those disadvantages were also ruled out gradually. And now I have noticed that more and more of my mothers are able to exclusively breastfeed. Or even if initially the initial few days, they may have to give a little top feed, which actually, can be totally avoided, but still there is a little trend of mixed feeding in the first few days of life. But after that, they switch over to completely to breastfeeding. They can stop top feed completely. And that's a very nice trend which I'm seeing now, that more and more mothers are exclusively breastfeeding their babies.
okay. Can you just brief everybody about the basics of breastfeeding and the physiology of breastfeeding?
Okay. So, breastfeeding is a completely normal, natural, instinctive way to feed a newborn. And nature has created that mechanism. So, I will try to keep our talk, Rucha, to a real, layman, simple
Yes.
language, because it's very easy. You're a doctor, I'm a doctor, and, we keep going on in the medical jargon. But I can see lot of non-medico people who have joined, which is also nice, because then all these people can themselves also become active advocates, of breastfeeding. So
Yes.
it's a very natural, instinctive way, and our body is made that way. Nature has created us that way. So all the pregnancy hormones help prep and prime the mammary glands also, which are in the female breast. And these mammary glands also start becoming mature. There are certain changes which happen during pregnancy, and then once the baby is delivered, there are certain hormonal changes which happen, and because of which one particular hormone, which is called prolactin, increases. And this prolactin is responsible for manufacture of milk in the milk glands. So these milk glands, like a female breast, can be imagined like a sunflower. So the central circle and the petals of the sunflower are actually the mammary glands. And here
Okay.
the milk is produced, and then it is secreted through ducts and brought to the center, which is the areola and the nipple. So prolactin is responsible for formation of milk. And there is another hormone, oxytocin, which is also, useful in a lot of other ways. It is
Yes.
also a happy hormone, basically. So that hormone is also released, which helps to milk let down, basically. So the milk has to come out of the nipple. So it comes down from the glands towards the center, just behind the areola. And from the areola, it starts flowing towards the nipple. So that is called the milk letdown. So these two hormones are very important for the production and letdown of milk. And of course, the more the baby suckles, the actual sucking baby, the baby being close to the mother, the bond between the mother and the mother feeling nice about it, the baby feeling secure. So, all these psychological factors also play an important role to maintain these two hormones, and the actual act of breastfeeding happens. So this is, rough, quickly a basic physiology which happens, that prolactin and oxytocin are the hormones which are needed. And two very important things in breastfeeding, which are the hold and the latch. So hold is how the baby is held in the mother's arms. So we always guide the mother to, make herself comfortable, and the way to hold the baby. And we train the mother to hold the baby in one hand. So there are multiple holds. If you want, I can go in depth about it, but that can be easily found anywhere. And when the actual time of doing breastfeeding happens, we
Right.
pediatricians do counsel the mothers, and of course, lactation consultants are always there to help us out and help the mothers out. So, what is important for anyone who wants to promote breastfeeding is to know the correct hold. Okay. From mother to mother, it can vary. So, for that mother baby pair, it can be that particular hold which is comfortable. So there is no single rigid rule as such. It's just a guideline. So basically, the baby and the mother are close tummy to tummy, and the mother is holding the baby in one hand, and the other hand is supporting the breast. So that is the hold for the baby. And then the latch. The latch is also very, very important, because the way the baby holds onto the breast is the very tricky part, because when it is done correctly, breastfeeding is not hurtful, not painful at all, and which
Yeah.
is ideally what it should be. But when the latch is wrong, it can hurt. And typically,
Okay.
it can give sore nipples to the mother, and then the mother can be discouraged to breastfeed because of that. But a simple correction and helping her with the technique, and having a good latch can take away that pain and discomfort, and in fact also help heal the sore nipples. Because the trick is to not have the nipple near the mouth. The nipple has to be deep inside, near the palate of the baby. And
Yes.
what the baby presses on is the areola actually, and not the nipple. So these few small techniques can be discussed with the mother, and the mother can be helped, and things can be very easy. So breastfeeding is a very pleasant, pleasurable and happy, secure kind of a feeling for both the mother and the baby. And it should not be stressful. It should not cause a lot of pain. It should not be that the mother is, bearing the pain. So if that is happening, I would definitely ask the young mothers who are, listening to us, to seek help. So there are people who can help you, and do not hesitate to seek help. So breastfeeding has to be a nice, happy experience. It should not be stressful. So if it is becoming stressful, please, please do seek help.
Yes. So actually, this year's theme of Breastfeeding Week is support breastfeeding for a healthier planet. So they are focusing more on supporting those who are breastfeeding with breastfeeding counseling, and that is the whole theme of this year. It's not just the mother who is responsible for the breastfeeding, but the entire family, and there should be people who should counsel time to time these breastfeeding mothers on how to counsel and give support to her. So I would like to ask further, how does breastfeeding help the mental health of the mother?
Okay, so breastfeeding is, as I told you, there are two hormones which are involved, prolactin and oxytocin. And
Right.
breastfeeding has immense benefits for the mother's, physical benefits for the mother as well, like reducing the risk of breast cancer, ovarian cancer, helping her lose weight because that is used in preparation of milk. So the weight loss, which naturally happens when the mother is exclusively breastfeeding, it is much more healthier. Then it also helps the uterus to come to normal size, the involution of the uterus. So all these are the physical benefits which the mother undergoes. But there are a lot of mental benefits also, because the very fact that the little baby is, the mother is able to exclusively breastfeed the baby, and the feeling that you are able to give complete nutrition to your little one, and you are the one who is responsible for giving the best of immunity, the best of nutrition to the child. It's going to ultimately lead to a healthy, foundation for the baby, healthy bones, healthy teeth, healthy muscles, good immunity, good eyesight, good IQ, so all these benefits which for the baby, the very fact that the mother is, aware that, it's all possible because I'm able to breastfeed. So this
Right.
feeling, according to me, and the joy of being a mother and breastfeeding together, combined is, unmatchable. So that is definitely a positive impact on the mother's mental status. It's like a mood
Right.
booster, and it's like a confidence booster as well. That definitely is there. Oxytocin again is a feel good hormone, so that
Yeah.
also keeps the mother's mood happy. So
Okay.
I feel for the mother there are a lot of positive benefits of successful breastfeeding. Yes.
Yes, but there are also times when the mother cannot produce milk properly, or the baby is preterm, and there is not enough milk to feed the baby, or there are some physiological problems like retracted nipple or whatever. Then what effects does this have? Adverse effects does this have on the mother's mental health?
So right. So what happens is typically there is something called baby blues. So even
Okay.
postpartum, because of lack of hormones, the hormones suddenly drop in the woman's body, and then she may have mood changes. So
Right.
women may feel very irritable, women may feel, very sad, they may feel very angry at times, they may, and again also they may feel guilty about feeling all this. But all what I'm describing all is in the range of mild mood changes, so most of the women face
Right.
this mood changes, and only about 5% may have the real postpartum depression, so
Right.
whatever low phase you are going through or you are feeling, another add-on is the sutures, it may be a normal delivery, or it may be a C-section delivery. The sutures may hurt, and there may be discomfort on those lines. So all that added can have an impact on the mother's mood. So what I would generally suggest is, and what us professionals, right from gynacs to pediatricians, we always try to pick up these cues from the mothers who come to meet us, and we encourage them to take early help. The simple mild postpartum blues can be tackled just when I tell my mothers that, all this is expected. Just by
Right.
knowing that this is expected, and I am not the only one to feel this, their guilt goes away, because otherwise there's
Okay.
a lot of guilt that, I have a nice lovely baby with me and I'm feeling so sad.
And I'm
There's
feeling
some
low.
problem with me, so most of the times when it is
Right.
mild postpartum blues, it does goes away just by, when we talk to them and we let them know that this is normal. And for the genuine postpartum depression, there is always help available. We have qualified psychologists and counselors, and there is definitely help for that 5%, 3% mothers as well. So that is
I will chip
uh,
uh, sorry. I
tell
will
me.
chip in over if anybody needs such kind of counseling. There are trained counselors in Samvadsa team, and
Great.
we can provide. Right now, it's everything is online, so we can provide telephonic counseling. So
Wonderful, wonderful. So now I have one additional go-to for my moms who feel low, So definitely you people can help me help my
yes,
moms. Yes. And so that is one aspect of postpartum phase. and it
Okay.
can stay from 2 to 3 weeks, and gradually it goes away.
Okay.
But I have noticed that young mothers, in today's competitive world, there is a kind of a competition with oneself, that I want to be the best mother, I want to be the best wife, I want to be the best possible for whatever I do. And that in
Right.
itself, builds up kind of a stress. And then what happens is young mothers are, I have noticed they are so competitive that they either want to do completely perfectly, and a little hitch somewhere, a little discomfort somewhere, and then they just give up, that like, no, this is not done.
Oh,
How I'm not able to feed, and even
right.
such kind of thinking, I need to counsel them that you just go slowly, tackle things one by one, take help, and it is okay to not get it right in the first go, because
Right.
the mother and the baby, they are ultimately having a coordination among themselves for them also to get used to each other. It takes time. The little
Right.
baby was inside for the entire 9 months, and now he or she has the responsibility of taking his or her own nutrition by,
Right.
sucking. So even for the
Right.
baby to, have that coordination with the mother, for them to gel well. And that is why we have this concept of, rooming in and bedding in. So we always encourage the new mothers to have the babies right there with them, to talk to the babies, hold them close, not just for feeding, but otherwise also. So that helps in creating that bond, and then breastfeeding becomes easier. But that is a fact that mothers are taking too much stress of performance, that I want to do it properly. So rather than
Okay.
taking stress, I always urge my new mothers that, you take it in its own stride. Basically, it's a very natural thing. So don't, rather than taking stress, just get authentic information and just have that positive optimism that yes, you will be able to do it. So that is somewhere they need a little help. Then another
Yeah.
thing you mentioned was about preterm babies. So when preterm
Right.
babies, the more the prematurity, there is this mismatch where they are not able to suck very well. Second is the sucking and the swallowing coordination, which doesn't happen before 32. So right
Oh,
after 32, there is that suck swallow coordination. After 34, 36 weeks, it is much more better. So the more the prematurity, the more there are going to be feeding issues. But then such mothers, they need intensive counseling. But when we
okay.
tell them that, your body is built that way, that when your baby is born premature, the milk that your body will produce is perfect for that baby. You know, the mother produces tailor-made milk for her baby.
Okay.
Whatever is the gestation of the baby, whatever are the requirements for the baby. So ultimately, nature is actually, taking care of everything. So we just need to instinctively do whatever feels correct. So for such mothers, preterm babies who are separated from them, who are in the NICU, then these mothers are encouraged to visit them in the NICU. Depending on the baby's birth weight, very small babies, they cannot be handled initially, but gradually as they start gaining weight, they are given to the mother to hold, to give skin to skin contact. A little bigger baby can be actually kept with the mother as kangaroo mother care. So all that
Yes.
helps, increase the bond and helps the mother lactate as well. And she's encouraged to express the milk and give it to the baby. So when feeds are started, and if we have expressed breast milk, that's the best. So there are
Oh,
ways to, tide over all these ups and downs which are expected when there is a preemie or when the mother is not well herself. But there are certain conditions in wherein the mother can still breastfeed. She may have a little fever, she may have discomfort, but she can still breastfeed. And exceptionally, there are certain cases where the mother cannot breastfeed because of very severe illness or sickness. Then those also can be, tided over. But the most important thing is what you are doing as someone, that we need to have an open communication and counseling the mother and the baby for that particular situation, what works best for the mother.
so we have a few questions. Advik is asking, it is said that if the baby is fed more or less, it actually influences the personality of the child in adulthood. Is it true? So basically, can you tell us about the psychological effects on the baby of breastfeeding?
Okay, so when the baby is being breastfed, the baby is inside the mother for 9 months. So the babies are very well tuned to the mother's voice, the mother's heartbeat, because in the womb also the uterine artery, the whoosh whoosh of the uterine artery is constantly there, around the baby. When the baby starts hearing, it's able to hear by around fifth month of gestation. So after that, the baby knows the mother's voice. The baby knows the sound of the mother's heartbeat and the uterine artery flow. The baby knows the changes in the mother's mood because of the changes in the heartbeat, the changes in her tone of voice. The baby also knows other voices which are, constantly heard. Most commonly, it's the father, but even the other voices. So when the baby has come out of the womb, it is not that it is completely, new and doesn't understand anything. It definitely recognizes the mother's smell, the mother's voice, and the mother's heartbeat. So when the baby is held close at the breast, it feels very secure. It doesn't feel left
Right.
out. So that kind of a secure feeling is very good for the final personality development of the baby. A secure baby always grows up into a secure child and a secure adult. So that is one very positive benefit, the bonding with the mother, the feeling that, I'm being taken care of and my mother is there for whatever problems I may face. So those are very strong positive benefits of breastfeeding for the baby. And the mother's mood also, affects the baby. I have noticed this. I did not read this in any of the textbooks per se, but I gradually started noticing it in my practice itself, that anxious mothers equate to cranky babies. So when mothers are more happy, more confident because of whatever factors, their personality, or maybe counseling, help from pediatricians, help from counselors, help patient consultants, whatever is the reason. Of course, support from the entire family, primarily the spouse, but also the rest of the family. And when that happens, a calm and a contented, happy mother equates to a calm, happy child, baby. So that is
Right.
always a correlation which we see. An anxious mother, the baby senses the anxiety and baby continues to be cranky. So a cranky baby who feels insecure, who doesn't have that confidence that the baby will be fed, on time properly. Those ups and downs in the mental changes of that small newborn has a strong impact later as well. So a successful breastfeeding has a benefit, positive benefit for the newborn too.
Okay. Another question is, if supply is low, how topping up with formula affects the baby, and can postpartum depression affect mother's breastfeeding? I think we covered these points, but if you have anything else.
One point I will just add about the formula. See, typically it is advised that after delivery, may it be normal delivery or a C-section, it's best to start breastfeed within an hour. Okay.
Okay.
And all pre-lacteals have to be avoided, which most of us know already, but there are certain very, very senior members in the family who would still insist that they want to give pre-lacteals, like uh, there's a gold ring in honey or something, so all these things tend to increase the chance of infection, obviously. So we have to patiently and calmly explain to these seniors as well, because we want their support as well for exclusive
Right.
breastfeeding, that now science has shown us, research has shown us that all that is later harmful for the baby, that may suppress the hunger drive of the baby. So we want her to take her breastfeed first rather than something apart from breast milk. And how breast milk is important, how colostrum is really, really rich in the immunity ingredients, rich in protein. So that is the first milk which may not be really visible for the first 3 days, but it is important and the baby gets it. You may not be able to see it, but when the baby is suckling at the breast, the baby gets the milk, colostrum. So all these things need to be conveyed, not just to the mother, but to the entire family, to the grandmother of the baby also, because ultimately the mother and grandmother together are going to work things out, sometimes the father also, because in nuclear families it's the father who's helping the mother. So the entire family needs to be involved in these counseling sessions. And so pre-lacteals need to be avoided. Mother needs to be encouraged to exclusively breastfeed, and then she has to be given that confidence that uh, just let the baby suckle and the baby is going to get enough nutrition. So for the first 3 days you may not feel the milk flowing, but still baby will get the colostrum, so that, because mothers don't know, they feel I don't have milk, so let's start the top feed. And then what happens? Baby takes top feed, baby is suckling less at the breast, then the milk flow drops, because the single strong stimulus for milk production and milk letdown is the baby suckling at the breast. So when the number
Okay.
of times the baby suckles reduces, the mother's body feels that it is not needed. Baby is suckling less, so milk is not needed. So it drops down the milk supply. So, and that again is like a preparation for reducing breast milk and going completely on formula or bottle or whatever. And that again has its own, this thing disadvantages. So insisting and supporting rather than stressfully insisting that no, nothing doing, you have to do this only. It's just supportive, exclusive, that you will be able to do this, don't worry, and just having a count of checking the baby, explaining to them that how many times urine is passed, how active is the baby, uh,
Right.
daily weight check of the baby in the maternity, daily weight gain, weight loss initially, so how much is it, whether it is appropriate or not. So all this thing helps to calm the mother. So that's important. So I would strongly suggest exclusive breastfeeding for babies, and of course from case to case. So when we as pediatricians go and we see this baby really trying, but the baby is dehydrated, losing more weight, then we definitely have to help them with formula feed. But again, with this understanding that it's going to go away as early as possible whenever the mother's breast milk picks up. And the aim is to help the mother, support the mother, counsel the mother. And ultimately, as I told you, I have noticed that most of the mothers are able to exclusively breastfeed these days.
Okay. So there's one more question. There's a mother I'm a mother of two to a 7 week old. My baby tends to spit up a lot of milk, and I'm never sure that I'm able to provide proper nutrition to her. This causes me a lot of stress. Yeah,
Yes, a
and
very, very common thing to happen in babies. So babies tend to spit up a lot. They tend to vomit at the drop of a hat.
yeah,
So vomiting is very, very natural in babies. But how does a mother know that whether she's able to produce enough milk and whether the baby is satisfied or not? Then two simple things, if the baby is awakening from time to time and demanding milk and sucking well, when the mother is feeding from one side, if the mother has a little wetness on the other side, that means there is good milk supply. And the number of times the baby passes urine. So in 24 hours, a baby should typically pass about 7 to 8 times urine. And if that is happening, and there is milk supply on, like little dripping on the other side also, and baby is taking milk at regular intervals, then there's nothing to be worried about the little spit up at all. Because if there is, and of course, the next third step is to go to the doctor and get the weight checked. So if the weight trend is good, then the spit up, the big vomits, everything is absolutely normal. We call it reflux, and a lot of babies have it. So nothing to be worried if these things, as what I told, are happening.
so I think basic knowledge of breastfeeding and what happens during breastfeeding is needed for a mother to reduce her stress levels. Like being
Absolutely, absolutely. So I have noticed that a lot of things which the mothers are worried about are actually normal in a newborn. You know,
right.
right from breastfeeding to a lot of normal things which happen in a newborn, which if the mother is aware about it, she will obviously be very, very less anxious, or no, not anxious at all, and that will help her establish a good exclusive breastfeeding. And it will be beneficial both for the mother, the baby, the entire family, because a calm baby, the entire family is also sorted. So a lot of things which are actually normal, but which the mothers do not know, and which may lead to added stress.
Okay. So I think we'll take the last question, uh, and we'll ask if there are any questions from the people who have joined us. We will take those questions. So this year's theme is support breastfeeding to for a healthier planet. So can you tell something about that? Why this
Right.
theme?
So correct, correct. So, healthier planet, why? Because if you notice, Rucha, a lot of our activities are causing a lot of damage to the environment. Because of the pandemic, we noticed that when the cars went away from the roads, the skies cleared. We could
Yes.
actually hear birds chirping. So nature also has a way of recovering itself, and
Right.
which is so nice that it made us realize that okay, we were really, really harming our environment by just simple activities of car emissions. And so similarly, breastfeeding is so natural that it does not require any utensils. It does not require any added fuel to boil the water to sterilize the bottles. It does not
Right.
require bottles and material which is used to make those bottles, and it is at that perfect temperature. It is directly from where it is manufactured to the baby. It is such a short distance, so that is
Yes.
the best possible nutrition for the baby, and it only requires 500 kilocalories extra, which is the mother's food.
Right.
Correct. So it hardly needs anything else. But as against that, if someone who's not breastfeeding, and obviously then the baby has to have what? Either a formula or some other milk like cow's milk or whatever. So what happens? Formula is also made from cow's milk. So first is rearing of these cows. So when these cows are reared, they are fed on pastures. So to make these pastures, the meadows, forests are cleared. So that is deforestation. Second, again, certain crops need to be grown, like corn or soy or whatever, especially to feed these cows. So again, forests are cleared to make these fields. Then extra water is needed to grow these corn and the cow feed basically. Again, water is needed to rear these cows. Then the process
Right.
of milking the cows, processing the milk, transporting it to the factory which makes this infant formula. Then the entire process of, converting this milk into the final formula, addition, subtraction of a lot of things, partially, processing the proteins in the formula, adding some vitamins or whatever, So a lot of process which happens that also needs a lot of energy. It leaves behind a huge carbon imprint. Then again, the transport and the packaging of this formula in metal tins, in cartons, then again transporting it from wherever it is made to the consumer. So that transport is added stress on the environment. Then the bottles which are used. So the tins, the plastic bottles, all this generate a lot of waste in our environment, which is really harmful. So, just the very simple fact of not breastfeeding has a big cascading effect, right from rearing the cows, the entire dairy industry to the industry where the formula is prepared, to the transport, to the packaging, till the consumer. So it's so much of a cascading effect on the environment, which can be totally avoided. And this is just one part of the benefit of breastfeeding. The major
Right.
chunk is the health benefit to the mother, the immense health benefit to the baby, and then this is also an added part which also has become more and more relevant now. Because if we keep on going the way we are, at full speed with what reckless abandon about our nature and our mother earth, within a few decades, I think we will not have the same environment that we have now. So we have a strong responsibility to our future generation, where whatever small things we do now may help have a better environment for them. So that is why this theme for this year, so ultimate focus is to promote breastfeeding, but the main aspect this year is how we can even save the environment when we promote breastfeeding.
Right. So I just got a question on top of my head. Uh, how does support groups help counsel a breastfeeding mother? Is it happening in India, or I mean, support groups are not a thing in India right now, but
Right. So
through
official
Samvad.
support groups, official support groups may or may not happen. Like the baby friendly hospital initiative has those 10 steps which India has adopted since 1992, which says that a baby friendly hospital has to have an associated, or it's better to have a support group.
Support group.
A physical support group, how much it is happening, it is happening on a smaller scale, but because of the social media these days, we have a lot of support groups of mothers who have WhatsApp groups and who share their concerns. But a strong this thing, a line of caution here is that having a support group is brilliant, but at what point you need to consult a professional, until what point you can just discuss amongst fellow mothers and you may find solutions. To understand that is very important, because
Okay.
it should not happen that myths are being propagated.
Uh-huh.
So correct knowledge has to go. So the support group also has to be through a qualified organization or a group of people. So like Samvad, or those who are in the know-how, and then they can initiate the support group. So then it will be a real kind of a support group where a mother has an issue, a minor issue, she discusses it with other mothers who have gone through the same thing, and then they may give her tips, and that may
Right.
help. So it has to be the correct kind of a support group.
Correct. The right kind of conversation needs to happen. Yeah. So
Correct.
there's a question again from Advik. Does the environment affect the body mechanisms? Like if there are stressors prevailing in the environment, will it affect the production of milk?
Yes. So environment, that I think what Advik means is the toxins in the environment.
Right.
So right now, our daily activities also involve a lot of chemicals and toxins. So there is again one more drive, which is encouraging people to go more and more natural and rather organic. Correct,
Right.
because minimum use of pesticides, fertilizers, actual farm to plate distances should be very less. So that applies to all of us, but specifically also to the lactating mothers. And why lactating? Right from conception, or I would even say preconception, because uh, a healthy woman of childbearing age group, her spouse who is healthy, both of them together would, give rise to a healthy embryo and a healthy pregnancy, then a healthy lactation. So, the life cycle continues. So, when all of us are trying to go more and more natural and organic, having minimum chemicals around us, trying to reduce whatever chemical possible, exposures we may have from the environment, such as, pollution, smoke, even our day-to-day activities, simple things like dhoop and agarbatti in the house, if we have those chemical smells and artificial perfumes, it has an impact on the health. Although it is, you can't really quantify that impact, but when that is taken out of the equation, definitely the overall health of the individual improves, and that will also have a good effect on the lactation as well. If there are a lot of heavy metals in the food of the mother, not
Huh.
consciously, but maybe through some uh, maybe some fish may have some heavy metals into them, or
Right.
bigger fish especially, or some medicines some people take without consulting proper physicians. I would not label them as Ayurvedic medicines, because a real Ayurvedic medicine would not really harm you when taken correctly under correct guidance from an Ayurvedic doctor. But sometimes, someone says something and they start taking. So these
Right.
powders may have heavy metals, and these heavy metals or certain toxins can build up in the person and can have an effect on the milk as well. So I would strongly suggest all of us, and especially mothers of childbearing age group, pregnant women, lactating women, to maintain as healthy a lifestyle as possible with least amount of chemicals involved.
Okay. Thank you. And any last take-home message you would like to tell all the lactating mothers?
The take-home
Some.
message is, are there any new questions coming up? Then maybe you
Like,
let me know when to wind up.
yeah. Are there any questions? Anybody, if you have any doubts or questions, you can ask right now. Uh, Advik is currently doing psychology, so
Okay.
he is asking questions, but I don't know about others.
Sure. So whenever we get a question, we can tackle that,
Yeah.
and I can just start telling you. So the take-home message, not only for lactating mothers, but everyone who has joined. I know thank you so much, everyone who joined in and who interacted, asked questions. The take home message would be, let all of us become active advocates of, supporting breastfeeding. Because as we all of us now by now know that breastfeeding is not just the activity by that one particular mother for that one particular baby. It involves everyone. If the mother does not get that enough peace of mind, she's all the time overworked, she doesn't get enough help in the house from her spouse or the other relatives, the seniors, then she is stressed and she will not be able to give justice to breastfeeding the baby. So she needs a lot of help and support in the house itself, from her spouse, from the other family members. And again, does it stay only to the house? No, it goes out to the community as well. So as a community, we need to be supportive of breastfeeding. So at times it does happen that there is a mother in public, a baby is howling, crying. And then if the entire community is supportive, there are ways of the mother being able to breastfeed, even in public, without shame or taboo. So that has to be, because it is the most noble thing that is happening, feeding a baby. It should not have any connotations attached or taboo attached to it. So from beyond the house, it goes to the community. So when everyone has that supportive approach and attitude, it is best not only for the mother and not only for the baby, but for the entire community as well. And again, like this year's theme we discussed, it is eco-friendly. It's going to ultimately save the environment in the long run. So what more do we want, So the main take home is for all of us to be very, very active promoters of breastfeeding, because that's the first most
Right.
natural feed and the best feed that the baby can have. We call it liquid gold, that's the best. Because sometimes I get questions from mothers that I am able to breastfeed my baby, but I have heard XYZ formula is great. It's just,
Right.
it's imported in the US. My friend used to give that. Now it's come to India. I've heard it's very good. And then, I have to actually explain to them that how much ever great and good a formula is, because science has advanced, their research has advanced. So they are trying to become as close to mother's milk as possible. But mother's milk always remains the gold standard against which each and every infant milk substitute is compared. And nothing up till now is exactly same as mother's milk, and definitely nothing which is tailor made for that baby, that mother, that baby. When the baby has a little cold, a little sick baby, that mother's milk definitely has more antibodies for that particular baby. That's nature's
Right.
normal mechanism for hastening recovery, So the best thing is to have nature take its natural course, and let's not have our interference in it, and let's just trust our natural instinct. Let's just trust our human physiology, and support breastfeeding in every possible way. So especially for young mothers, expectant mothers, when they're primed like this throughout pregnancy, when they hear and when they read up more about the benefits of breastfeeding, then they are all primed for doing it nicely, and then it would happen. So that's what is more important.
Thank you, Anuja, that you have put it very beautifully, and the importance of breastfeeding and how we should become advocates of breastfeeding. And we will definitely become one. And through Samvad, I think I will tell all my counselors to to support breastfeeding. And if there are any
Great,
mother
great.
counseling, they can contact us, and I'll put them in touch with the counselors
That's
and
so nice.
them.
Rucha, there's a question from Henna.
Okay.
So I think, yeah, what changes to
What?
expect emotionally when moving towards weaning or starting off solids? Do you want me to take it quickly in a minute or
Yes, yes,
so?
we have time. Yeah, we have time.
Okay, okay. Yeah. So, Henna, what happens is when the baby is feeding exclusively, usually till about 6 months, we let the baby feed exclusively when there is good weight gain. And WHO also recommends exclusive breastfeeding till 6 months. But again, as a pediatrician, I must put in a word here that it is for that baby and that mother. And we take a call whenever the baby reaches about 5.5, 6 months. So typically, most babies do very well only on breast milk for 6 months. The weight gain is nice. The feeding frequency is as it was before. It's not increased. They are not cranky. Then they can continue to breastfeed till 6 months and gradually start outside food. We call it complementary food after 6 months. So what
Yeah.
happens is emotionally, usually at this time, Henna, there are not many changes which are happening, because at this stage, the baby is developmentally ready to accept new foods also. And it also wants to explore new foods. So when the baby is actually watching adults eat, the baby is actually wanting to, uh, take things, try to mouth them. So that is a very, very natural phase for the baby, and that also helps the mother, because then gradually outside food is started, breastfeeding is continued, it is not reduced. We usually follow a baby-led method of weaning. Rather than weaning, I would say complementary feeding, because breast milk is not reduced. Baby herself or himself takes it less number of times because solid food is also there. But that is up to the baby. The main task is when to stop breastfeed ultimately. That is the main challenge. So I guess Henna is a little away from that point. And when that happens, you can call me anytime and I'll help you. But that has to be again a point where the mother has to be convinced that the baby does not need breastfeed anymore, and the baby is just doing it for pacification. So WHO recommends up to 2 years you have to breastfeed, but that is always not applicable for all societies or all scenarios, because
Correct.
it can happen that the baby just does it for pacification. So it's eating very well, and just for pacification the baby keeps suckling. It actually, the quality of milk when the baby is 2 years old or 18 months old may not be as great as it was when the baby is very small, because again, nature has that mechanism, whatever is needed it will prepare.
Right.
And it is just that dependence on the mother, the separation anxiety, and the baby then has reduced hunger for solid food. And then at that time, breastfeeding tends to become a, a problem rather than a solution. But then that can happen 18 months, 2 years onwards, not before that. So at that time, mothers have to be told how to handle that, have to stop breastfeeding so that the child will start eating good solid food, because at that point it starts hampering their nutrition. But for our purposes for today's talk, when we are focusing for exclusive breastfeeding, it's for the first 6 months. So start as early as possible within 1 hour. Continue to exclusive breastfeed even the first 3 days colostrum, which is very, very important, and later also. And one more point is demand feeding is more important, but again, depending on the baby's weight, the baby's gestation. So very premature baby may not really, understand hunger and may not really cry. So for that baby and that mother, we have a specific set of instructions. But as a general thing, demand feeding is encouraged. And again, we do not allow the baby to cry when the baby has awakened, has started making a little movement of the mouth, a little light sleep, so we know that the baby has slightly awakened now. We immediately ask the mother to take her for feeding rather than waiting for the baby to cry, because crying is a late cue. So we do not want to wait for the late cue. We want to catch the early cues, which are just a little light sleep, a little movement of the mouth, a little cooing, opening of the eyes. So we encourage mothers to catch the early cues and do feeding on demand.
Okay, great. Any more questions? Okay. So it was wonderful talking with you. Thank you, Anuja, for doing this again.
Thank you so much, Rucha. I also had a lovely time discussing
Yes,
all the nitty-gritties, and thank you
yes.
so much for inviting me here. And all the best to you for the wonderful job that you have started doing, and may you grow by leaps and bounds at Samvad.
Thank you, Anuja, so much. And I hope this talk will help all the breastfeeding mothers. We will be saving this video and putting it on YouTube also. So I hope everybody takes a lesson from this video. Okay, we should,
Great.
we'll end this now.
Bye. Yes.
Bye.
Okay. Bye. Bye, everybody. Bye.
Bye. Bye. Thank you everyone
Bye.
for joining.